Question 1. A nurse is prioritizing care for 4 clients. Which client should be seen first? A. A postoperative client reporting pain of 6/10. B. A client with pneumonia and a temperature of 100.4 degrees Fahrenheit. C. A diabetic client with a blood glucose of 60 milligrams per deciliter. D. A client scheduled for discharge this afternoon. Answer. C. A diabetic client with a blood glucose of 60 milligrams per deciliter. Question 2. Which task is appropriate for the nurse to delegate to a nursing assistant? A. Administering oral medications. B. Performing sterile dressing changes. C. Assisting a stable client with ambulation. D. Evaluating a client's response to pain medication. Answer. C. Assisting a stable client with ambulation. Question 3. A nurse is assigning tasks to a licensed practical nurse, LPN. Which of the following is appropriate? A. Teaching a newly diagnosed diabetic client about insulin. B. Starting a blood transfusion. C. Administering oral medications to a stable patient. D. Performing the initial assessment on a new admission. Answer. C. Administering oral medications to a stable patient. Question 4. Which client should the nurse assess first during the morning shift? A. A client with COPD who is awaiting discharge. B. A client with asthma who reports shortness of breath. C. A client recovering from an appendectomy. D. A client requesting assistance with morning hygiene. Answer. B. A client with asthma who reports shortness of breath. Question 5. Which situation requires the nurse to intervene immediately? A. A UAP helping a client to the bathroom. B. An LPN administering a routine medication. C. A UAP checking blood pressure on a new admission. D. An LPN assessing a newly admitted client. Answer. D. An LPN assessing a newly admitted client. Question 6. A nurse is caring for 4 patients. Who is the priority? A. A client with nausea and vomiting. B. A client scheduled for surgery in 4 hours. C. A client who has not voided for 8 hours. D. A client with a potassium level of 6.2 milliequivalent/L. Answer. D. A client with a potassium level of 6.2 milliequivalent/L. Question 7. Which task can the nurse safely delegate to the UAP? A. Feeding a client at risk for aspiration. B. Turning a client every 2 hours. C. Monitoring a client receiving for morphine. D. Instructing a client about fluid restrictions. Answer. B. Turning a client every 2 hours. Question 8. Which of the following clients should be assigned to an experienced LPN? A. A client requiring education on insulin self-administration. B. A newly admitted client with chest pain. C. A stable post-op client needing wound care. D. A client requiring 4-push medications. Answer. C. A stable post-op client needing wound care. Question 9. Which finding requires immediate intervention? A. A diabetic client with a fasting glucose of 110 milligrams per deciliter. B. A client with heart failure and 3+ pitting edema. C. A post-op client with a blood pressure of 88/50 mmHg. D. A client reporting mild incisional pain. Answer. C. A post-op client with a blood pressure of 88/50 mmHg. Question 10. Which of these clients should the nurse assess first? A. A client reporting incisional pain rated 8 out of 10. B. A client complaining of dizziness when standing. C. A client who needs assistance with feeding. D. A client with a serum sodium level of 138 milliequivalent/L. Answer. B. A client complaining of dizziness when standing. Question 11. The nurse is delegating tasks to a UAP. Which action requires correction? A. UAP taking vital signs for stable clients. B. UAP helping with bed baths. C. UAP assisting with feeding a stroke client with dysphagia. D. UAP reporting low urine output. Answer. C. UAP assisting with feeding a stroke client with dysphagia. Question 12. Which task is outside the scope of practice for an LPN? A. Administering intramuscular injections. B. Assisting with routine wound care. C. Performing a focused respiratory assessment. D. Initiating a care plan. Answer. D. Initiating a care plan. Question 13. A nurse is working with an LPN and a UAP. Which task should be completed by the RN? A. Bathing a client with limited mobility. B. Administering oral medications to stable clients. C. Developing a plan of care for a newly admitted client. D. Taking daily weights. Answer. C. Developing a plan of care for a newly admitted client. Question 14. A client with a tracheostomy suddenly develops respiratory distress. What is the nurse's priority action? A. Call the healthcare provider. B. Increase oxygen flow rate. C. Suction the tracheostomy. D. Check vital signs. Answer. C. Suction the tracheostomy. Question 15. Which situation should be reported to the charge nurse immediately? A. A client refuses their morning medication. B. A client's family requests a meeting with the provider. C. A post-op client with a dressing saturated in blood. D. A client asked to speak to a social worker. Answer. C. A post-op client with a dressing saturated in blood. Question 16. Which client is appropriate for the RN to assign to an LPN? A. A client receiving continuous 4-heparin. B. A client requiring a dressing change for a stage 1 pressure injury. C. A client needing for pain medication. D. A client needing initial teaching on colostomy care. Answer. B. A client requiring a dressing change for a stage 1 pressure injury. Question 17. Which action by a UAP requires the nurse's intervention? A. Repositioning a client every 2 hours. B. Ambulating a client after surgery without assistance. C. Emptying a Foley catheter bag. D. Measuring oral intake. Answer. B. Ambulating a client after surgery without assistance. Question 18. A nurse is caring for 4 clients. Which client should be assessed first? A. A client reporting pain of 5/10. B. A client who received for morphine 30 minutes ago. C. A client with an oxygen saturation of 89%. D. A client who is ambulating with assistance. Answer. C. A client with an oxygen saturation of 89%. Question 19. Which task should the nurse delegate to the UAP? A. Educating a client on insulin injection. B. Assessing a client's pain level. C. Documenting fluid intake after meals. D. Administering a subcutaneous injection. Answer. C. Documenting fluid intake after meals. Question 20. A nurse is supervising a UAP. Which behavior requires immediate correction? A. UAP using gloves to empty a catheter bag. B. UAP applying lotion to a client's back. C. UAP using alcohol-based sanitizer before feeding a client. D. UAP placing a soiled brief on a bedside table. Answer. D. UAP placing a soiled brief on a bedside table. Question 21. A nurse is preparing to delegate tasks for the shift. Which task is appropriate to assign to the UAP? A. Checking capillary blood glucose. B. Feeding a client with recent swallowing evaluation. C. Administering rectal suppositories. D. Collecting a urine specimen from an indwelling catheter. Answer. D. collecting a urine specimen from an indwelling catheter. Question 22. A client is scheduled for a dressing change. Which staff member is most appropriate to perform this task? ARN, B. UAP, C. LPN, D. Unit Secretary. Answer: C. LPN. Question 23. Which patient should the nurse assess first after receiving the shift report? A. A client who needs a routine insulin injection. B. A client with a history of COPD and increasing restlessness. C. A post-op client who voided 200 milliliters in 6 hours. D. A client requesting information about their lab results. Answer: B. A client with a history of COPD and increasing restlessness. Question 24. A nurse is supervising a UAP. Which behavior demonstrates the need for additional education? A. UAP places the bed in lowest position after care. B. UAP checks ID band before assisting a client to the bathroom. C. UAP elevates head of bed for a client on tube feeding. D. UAP adjusts oxygen flow rate without an order. Answer: D. UAP adjusts oxygen flow rate without an order. Question 25. A nurse must assign one of 4 patients to a float RN from the surgical unit. Who is the most appropriate assignment? A. A newly admitted client with diabetic ketoacidosis. B. A stable client receiving Schedule 4 antibiotics. C. A client requiring discharge instructions for heart failure. D. A client receiving a blood transfusion for the first time. Answer: B. A stable client receiving Schedule 4 antibiotics. Question 26. Which of the following assignments is inappropriate for an LPN? A. Monitoring for side effects of oral medications. B. Assisting with routine catheter care. C. Performing an initial assessment on a post-op client. D. Changing a dressing on a healing surgical wound. Answer: C. Performing an initial assessment on a post-op client. Question 27. What is the nurse's best action after a UAP reports a client's blood pressure is 78/40 mmHg? A. Recheck the blood pressure personally. B. Ask the UAP to retake it in 15 minutes. C. Notify the charge nurse immediately. D. Call the healthcare provider. Answer: A. Recheck the blood pressure personally. Question 28. The nurse is assigning care to a float nurse unfamiliar with the unit. Which client is most appropriate for assignment? A. A client with unstable angina. B. A client awaiting discharge teaching. C. A client receiving continuous insulin drip. D. A client requiring titration of 4-dopamine. Answer: B. A client awaiting discharge teaching. Question 29. Which client requires immediate assessment by the nurse? A. A client with a blood glucose of 145 milligrams per deciliter. B. A client with a serum potassium of 3.2 milliequivalent/L. C. A client complaining of left leg cramping. D. A client with newly slurred speech and facial droop. Answer: D. A client with newly slurred speech and facial droop. Question 30. A client with a chest tube suddenly complains of severe dyspnea. What is the nurse's priority action? A. Notify the provider. B. Assess for tracheal deviation. C. Check the chest tube drainage system. D. Provide reassurance. Answer: C. Check the chest tube drainage system. Question 31. Which action by the UAP requires the nurse to intervene? A. Recording intake and output on a client's chart. B. Turning a client with a spinal injury without assistance. C. Measuring blood pressure on a stable client. D. Assisting a client to sit in a chair for lunch. Answer: B. Turning a client with a spinal injury without assistance. Question 32. Which patient is appropriate for an LPN to monitor? A. A client with unstable cardiac arrhythmia. B. A client receiving 4-heparin with lab monitoring. C. A client with pneumonia receiving oral antibiotics. D. A client requiring central line dressing change. Answer. C. A client with pneumonia receiving oral antibiotics. Question 33. The nurse is delegating a task to a UAP. Which instruction is most appropriate? A. Go take blood pressure on room 3. B. Can you help room 2 get out of bed? C. Assist the client in room 4 to the bathroom and report if she is dizzy. D. Watch room 5 and let me know if anything seems wrong. Answer. C. Assist the client in room 4 to the bathroom and report if she is dizzy. Question 34. A nurse is reviewing assignments for the shift. Which client should not be assigned to the UAP? A. A client who needs vital signs monitored every 4 hours. B. A client requiring passive range of motion exercises. C. A client who needs assistance with toileting. D. A client with a new onset of confusion. Answer. D. A client with a new onset of confusion. Question 35. A nurse delegates ambulation of a client post-knee surgery to a UAP. What instruction is most important? A. Let me know if she seems unsteady. B. Use a gait belt and assist her as needed. C. Ask the physical therapist if she can walk. D. Offer her pain medication if she complains. Answer. B. Use a gait belt and assist her as needed. Question 36. The nurse finds the UAP applying restraints without an order. What is the nurse's best action? A. Document the UAP's action. B. Remove the restraints and report to the charge nurse. C. Call the provider to get an order for restraints. D. Observe the client to see if restraints are necessary. Answer. B. Remove the restraints and report to the charge nurse. Question 37. Which client would the nurse assess first after a report of overnight events? A. A client with stage 2 pressure ulcer needing wound care. B. A client who reports sudden vision loss in one eye. C. A client complaining of mild constipation. D. A client needing assistance with eating. Answer. B. A client who reports sudden vision loss in one eye. Question 38. A nurse is planning care. Which task is appropriate to delegate to the UAP? A. Monitoring a client with chest pain. B. Administering routine insulin injection. C. Assisting with bathing a stable client. D. Teaching deep breathing exercises. Answer. C. Assisting with bathing a stable client. Question 39. A nurse must float to the pediatric unit. Which assignment is safest for the charge nurse to give? A. A toddler receiving chemotherapy. B. A school-age child requiring pre-op teaching. C. An infant in respiratory failure. D. A child admitted for observation after a head injury. Answer. B. A school-age child requiring pre-op teaching. Question 40. The nurse notices the UAP failed to record the client's output. What is the priority nursing action? A. Document the UAP's failure in the chart. B. Ask the UAP to complete the documentation immediately. C. Report the UAP to the nurse manager. D. Reassign the UAP to a different task. Answer. B. Ask the UAP to complete the documentation immediately. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.